Well, good afternoon, everyone. Welcome to TMACC's Lunch and Learn. Today's topic is activating Chester County's Complete Streets policy in your community. I know that we do have some other fellow community members with us that are not in Chester County. When you adopt your Complete Streets policy, I think the same tactics apply to you folks, so thank you for joining us. I am going to share a couple of poll questions here with everyone, so that we can get a better understanding for folks that are out there today. As we go through this process today, we will be curating the questions. Jonathan and I will be monitoring the chat, so if you have a question, please drop it in, and we will then ask that towards the end with the Q&A side here. So Chester County municipalities are here being well represented, so thank you for joining us. And I will close and end this poll here. I'm going to share the results. So Jessica, you have your work cut out for you. 55% of the folks right now, they want to understand more on engaging residents. Now let's go to the final question. Let's focus on future programming. So folks are looking for implementation in their communities, and they want applications in the suburban environment are the two drivers there. And everybody wants to see an example. So we will work on pulling that together here as our next topic program as we move forward. Before we start the actual program here, I know that Brian Steich has a couple of words coming from the county on some of the initiatives on the Complete Streets that he'd like to share with everybody. Brian?
Thank you, Tim. My name is Brian Steich. I'm the director of the Multimodal Transportation Planning Division at the Planning Commission. And for all you managers and or secretaries out there, you may have and probably should have received a mailing that we sent out late last week that includes the county, a copy of the county's Complete Streets policy brochure, as well as a sample resolution that you may use towards adopting that policy. And also included within that email was a copy of the active transportation inventory report that we had prepared for you in late 2020. I won't get into any of the details of it right now, but we would be happy to present to your councils and or boards at any point in time in the coming months towards your municipal adoption of the county's Complete Streets policy. And if you should have any questions at all, please feel free to just shoot me an email, and I will put that here in the chat. So with that, I'll just turn it back to you, Tim. Thank you for the chance to make that announcement.
Thank you, Brian. You guys are great partners. So today's program came about during our deliberation of putting the Complete Streets policy together. I sat on the advisory committee through the guidance of Brian, and we came up with some great ideas and concepts, and we wanted to move it forward. And I know from my background working in the chamber world, when we talk about policy is a way to engage people. And so, when we want to talk about complete streets are about people and how people are using the street today, whether they're a pedestrian or a cyclist or in a vehicle, they're a delivery guy, who knows what we are, but we're all using the streets, and we want our streets to look a certain way. The Complete Streets policy gives us the guidelines to start implementing some of these things. And so we know that we need to engage the community on how we want our streets to look. And so, some of the things that I track, one of them is the Change Lab Solutions and some of their work. And I reached out to them and got introduced to Jessica Wim. And so Jessica is here today to talk a little bit about what Change Lab Solution does, and they're policy oriented for initiatives, health-based in a lot of their work. And I thought it was really important for our planners and our municipal planners to kind of start looking at this as we start rolling out the Complete Streets policy for the county. With that, Jessica, I turn this floor over to you, and have fun with it.
All right, thanks. I'm gonna share my screen. Bear with me for a second while I get all set up. Okay, can you all see my slide?
Yep.
And only a slide. All right, here we go. Oh, hold on, let me do one more thing. Hi, everyone. Thanks for having me here today. As Tim mentioned, my name is Jessica Wynn, and I'm a senior planner at Change Up Solutions. where I help to develop resources for the field and provide technical assistance around topics related to the built environment and health. And my background is in city planning and public health. And so a little bit about Change Lab. We are a nonpartisan nonprofit organization that uses the tools of law and policy to advance health equity. And we partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. We have an interdisciplinary team that works with community organizations, governments, and local institutions to design and implement equitable and practical policy solutions to complex health issues. So our staff includes attorneys, policy analysts, and planners. And our work includes demystifying law and policy to increase community knowledge, capacity, and power, as well as center equity and decision-making to promote health, connecting across sectors to facilitate organizational learning and create shared understanding among different disciplines, strengthen the leadership, skills, and capacity of change makers who advocate for laws, policies, and investments that support people, especially those most in need, in meeting their basic needs. Developing policy and legal tools with the interdisciplinary lens with the focus on reducing the drivers of health inequity, elevating practical evidence-based and community-centered tools, solutions, and successes to scale interventions that improve health equity. And our goal is to dismantle the 5 drivers of inequity, which we've identified as structural discrimination, income inequality and poverty, disparities in political power, and governance that limits meaningful participation. And I encourage you after this meeting or right now to check out our Healthy Neighborhoods portfolio on our website. The link is there, where we have a whole collection of like planning and transportation resources, as well as other resources on our website about all sorts of things, good governance, food systems, schools, you name it, anything related to health equity. And today, much of what I'll be talking about is from these 2 main resources. A Guide to Building Healthy Streets is kind of our guide on complete streets that lays out the roles of partners, different steps, and how to incorporate equity into every stage. And then the Planner's Playbook is a more recent resource. It's about integrating equity into every planning phase, planning in general. So feel free to check this out as well. So today, I'll start with an overview of what complete streets are and the benefits of complete streets. We'll dig into complete streets policies and the components of an ordinance. I heard you're very interested in implementation. That's great. I will, go over kind of the roles of all the partners and stakeholders that can benefit your complete streets work. We'll talk about community engagement, a lot from the Planner's Playbook. I'll end with sharing some additional resources, and then we can leave some time for a Q&A. And my objective for you all today is to come away with some tools and resources on how to engage partners and community members in developing and implementing an equitable complete streets policy. So just to start with an overview, I'm sure you're all very familiar with this concept, but just to get on the same page, complete streets is an approach to planning, designing, building, operating, and maintaining streets that enable safe access for all people who need to use them, including pedestrians, bicyclists, motorists, and transit riders of all ages and abilities. And your strategy should be context sensitive to surrounding community needs and land uses. So there are many benefits of complete streets. Safety for one, because complete streets encourage more supportive infrastructure for people walking or biking or taking public transit. And this helps to create more space for different road users. It reduces conflicts between different modes, helps to reduce speeding, and in turn that can help to prevent traffic collisions. Complete streets encourage an active lifestyle by creating opportunities to integrate physical activity into daily routines. And regular physical activity reduces the risk of several health problems, including diabetes, heart disease, high blood pressure, high cholesterol, as well as certain cancers, stroke, asthma, and depression. And physical activity is also linked with higher cognitive functioning and improved emotional well-being. For healthy development, Complete Streets promote a balanced transportation system that supports lively streets where people walk and bike to everyday destinations, such as schools, restaurants, parks, transit, and jobs. And lively streets enhance the neighborhood economic vitality and livability. Walking and biking are also good for the local economy. Multiple studies show that people who visit shopping districts by bicycle spend more money on a weekly basis than those who visit by car. And construction projects that build biking and walking infrastructure also create more jobs than do traditional road projects. And lastly, making more sustainable and non-motorized transportation options accessible to people reduces our need and reliance on cars, and that can help reduce the amount of air pollution that's emitted into the environment. So next, we'll get into the details of a Complete Streets policy. But first, I want to take a step back a bit and just go over what a policy does. So a policy is important because it helps to establish a commitment to a goal, outcome, or initiative, set the framework and approach for future work, articulate what you want to achieve and how you'll do it, and create more accountability and transparency. And I know in Chester County, you're all striving to create an ordinance, a Complete Streets ordinance. And ordinances are great because they're legally binding, and they're most often used by local governments to make policy changes more institutionalized and permanent. And there are three kind of main components of an ordinance or any policy. That's the findings, definitions, and directives. So I'll go into each of these in more detail. And I know it's going to be a lot of information, fair warning, but this is all available kind of on our website, and I'll share the slides after this so you can go back and refer to it. So the first section, the findings or the whereas clauses, provide evidence-based facts that support the need for adoption of the ordinance. And the finding section is part of the ordinance, but it's not usually, it doesn't usually become part of or become codified in local government code. And so on the right hand side of the screen is just a screenshot from one of our model policies that we have on our website. It's not meant for you to be able to read them all in detail, but will give you an idea of the types of topics that you could cover in the findings section. So things like we have a disproportionate amount of collisions that happen in a certain area, or we prioritize the safety and health of our residents. And this is why we want to adopt a Complete Streets ordinance. The next part is definitions, and definitions clarify how words and phrases are defined and understood within the context of the document and the policy. And it's important to establish a shared understanding so that the policy is implemented consistently and nothing is left for open interpretation. And so some examples of things that you might want to define in your policy are complete streets, context sensitive, what a community engagement plan might look like, or what you mean by community engagement. And sometimes it helps you define what you mean by priority populations. And just note that preferred terms or nomenclature may change over time, and jurisdictions may choose to use different terms. For example, priority populations, historically underserved populations, community of concern. Those are all often used in different jurisdictions to kind of reflect a similar meaning, in that there are certain groups of people who stand to benefit the most from complete streets, but in the past might have been left out of the picture, or have had disinvestment in their neighborhood before. And so you're prioritizing those populations or those areas in your complete streets work moving forward. And then lastly, the directives in a ordinance specify the standards and procedures for how the policy will be implemented. So things that you could specify in your policy are things like establishing a task force or advisory board, how community engagement will take place, data collection and analysis processes, how strategies would be prioritized, any design guidelines that you want to adopt, and evaluation and reporting procedures. And the National Complete Streets Coalition developed these guidelines around 10 elements and a scoring criteria that help communities develop comprehensive and equitable complete street policies. And our most recent state model policy incorporates this guidance, and I believe your Chester County ordinance also is modeled after this. So again, it's important to embed equity throughout all parts of the complete streets policy and strategies, because we want to make sure that everyone benefits from the street improvements, and especially people who have experienced the greatest disparities in health, as well as this investment in certain areas in the past. So getting into implementation, where the work really begins. So a policy is not as effective without a strong implementation plan. And in our guide, Building Healthy Streets, we've organized the process into 5 main stages. And the information that I'm about to go over is all covered in that resource. And just note that these steps may not always be linear. We just put them in a certain order. You might need to return to some of the steps as you iterate and adjust your strategies over time. So those steps are: build your team, assess the landscape, get technical, engage and listen, and evaluate and learn. And collaboration with partners and stakeholders is crucial in complete streets, because it helps to better coordinate for corridor planning, funding for multimodal projects, and alignment across other plans and policies. And on this slide are examples of partners that you might want to engage throughout different stages of your complete streets work. So that's public health departments, planning, public works or transportation, parks and recreation, the fire department, police, schools or the school board, elected officials, and community members. So that could mean community-based organizations, residents, or businesses. So getting into CHALA, this is the first step, is to reach out to partners and form a committee or advisory board. And the committee should include departments and agencies, organizations, and individuals who bring varied expertise and perspectives. The role of the advisory board is really to provide input on decisions about strategies and projects, support community engagement efforts, evaluate proposed decisions and plans for potential negative or unintended consequences. They can help collect data and identify performance measures for your evaluation. And all the partners bring a unique area of expertise. For example, public health could bring some health perspective to the project. Planning can provide information on zoning codes. Police can provide information on safety. Schools bring a perspective about children and their families, and community members bring their lived experience of navigating the transportation system. And then on the right for each step, I've included some key questions to consider in order to integrate equity into every stage of your policy development and implementation process. So for this early stage of building your team, some questions are people from historically underrepresented populations, such as women, communities of color, low-income individuals, people with disabilities, and people who are unhoused, represented on the committee? And are all people in our community, especially these priority populations, benefiting from complete streets? The next step is assess the landscape. So to successfully implement complete streets, existing land uses and transportation plans and procedures may need to change. So it's important to conduct an inventory of all the documents and procedures that might need to be updated to align with the complete streets policy. So some of those planning documents might be things like capital improvement plans, regional transportation plans, local active transportation plans or your comprehensive or long range plan. And the partners can capitalize on their expertise to review the relevant documents. So, for example, planners would look at the development guidelines and zoning codes. Public health departments or partners can help look at like what are the health impacts of the physical landscape. The fire department can look at the minimum street widths that are needed for fire trucks. So things that you might not consider just based on your own area of expertise can really benefit from having kind of an extra set of eyes looking at this. And some questions to consider during this stage are how do existing policies, processes, and/or the physical environment affect people who use the transportation system, especially priority populations? And what barriers might there be to implementing complete streets in areas where priority populations live? So the next step is to get technical. So once the community has identified the list of plans, policies, and guidelines that need to be updated to implement a complete streets approach, the next steps would be to make the appropriate changes. And communities may choose to write and adopt their own street design guidelines or use existing design manuals that provide flexible, context-sensitive solutions for all transportation options. And some questions to consider during this stage are what strategies and practices ensure that priority populations feel safe and have access to new infrastructure and resources? And what groups of people or areas in your community suffer from poor health outcomes? Which of these health outcomes and health behaviors can be improved through safer street infrastructure and increased physical activity? And then the next very important stage is engage and listen. So in addition to the more traditional or familiar engagement forums, such as community workshops or trainings that we're used to as planners, experiential learning can be an important part of complete streets education. So like events like organized bike rides and walks can bring elected officials, planners, public health officials, or professionals, engineers and advocates all together. And these activities give people a shared understanding of the challenges and opportunities that exist. So here are some questions to consider are the materials written in an understandable way for a variety of community members. So that can also include language translation or interpretation that's needed. Are the events held in locations and times that are easily accessible to priority populations? And so in this case, during COVID, if it's in a virtual format, is that accessible for other people? Do they know how to access that? Has the committee partnered with organizations or groups, such as faith groups and neighborhood organizations, to ensure that the events reach groups that cannot or not usually attend? And are services like childcare or food provided that make the event easier for families to attend? And then last but not least, evaluate and listen. So in complete streets, it's important to identify your goals or benchmarks, and then the performance metrics that you will use to measure progress towards your goals. And keep in mind that success can be defined in many different ways. So tracking progress helps to create accountability and transparency. It helps to build support for future investments in complete streets, and it flags if plans or policies might need to be adjusted midway through. And it's always helpful if data can be disaggregated by sociodemographic factors so that you can identify any particular trends or disparities that might be emerging. So here you'll see that different partners can help to collect different types of data, right? So like with bike and pedestrian counts or walk audits, a variety of people can do this, but it's always a good way to get people on board and helping with this part of the data collection. And certain people might want to take the lead on it, whereas other partners are better suited to like assist with that or help analyze the data after it's been collected. Some key questions to consider during this stage are, do any performance measures demonstrate how projects are prioritized across neighborhoods? Can performance measures be disaggregated by race, income, gender, and other relevant demographic information? And has the committee effectively used the performance measures to demonstrate the equitable distribution of resources across different demographic indicators? All right, so that's the overview of the steps for complete streets implementation. And so now we'll get into community engagement, which should really be integrated throughout your process, but ideally it would continue outside of any specific project or planning process. Community engagement is important because it builds broader support for project and plans. Solutions are more effective and tailored to community needs because they're based on the local knowledge and lived experience of a diverse and representative group. It can help improve relationships and trust between community members and governing organizations. It helps to build a better understanding of differing and sometimes conflicting values or priorities, and helps to build a better understanding of the equity implications and effects of policy decisions, especially those involving priority populations. And I'll note that historically, priority populations have been left out of decision-making processes, and without direct engagement with these communities that will be most affected by the policies, decision makers and local government staff lack the necessary information to make evidence-based decisions that might be the most pressing community priorities. So we like to think about community readiness and institutional readiness when we think about community engagement, because to create the conditions for collaboration, internal government capacity and readiness must be built to effectively and equitably engage with priority populations and to work across departmental silos to solve community problems collectively. So community readiness is community members' interest, willingness, and capacity to take action on an issue. And it's important that community members feel heard and are confident that their perspectives will be taken into account. So things to build community readiness are things like trainings to educate community members about transportation and planning concepts, advocacy and leadership training, providing opportunities to serve on community advisory boards, and building or rebuilding trust if that's needed. And institutional readiness is a department or agency's interest, willing, or capacity to change internal structures in order to achieve equitable outcomes. So building institutional readiness can be done by forming work groups to foster collaboration, reallocating budgets to support community engagement, and trainings or workshops to unpack issues like implicit bias. And I just wanted to acknowledge that this work might be new or uncomfortable for department and agencies or for community members. And then we like to use this spectrum of public participation to think about different levels of community involvement and influence in planning or decision-making processes. So each level here, inform, consult, involve, collaborate, and empower, articulates a public participation goal and a promise to the public. So for each stage of your complete streets of work, think about how community engagement could benefit the work and which level would be most appropriate, and then what is feasible within the context of your work. There's not necessarily like a best or gold standard level of engagement, but you should just consider your goals and capacity when planning your engagement strategies. So I'll walk through each of these steps, and then I'll give some examples of what that really looks like. So I inform, the purpose is to provide a one-way communication of information. So things like this could be posting information on a website or press releases where your goal is simply just to get the information out there. Consult is the goal. In consult, the goal is to get feedback on issues, alternatives, or decisions. And strategies at this level might be surveys, focus groups, and testimonies at public hearings. For Involve, the goal is to work with community members throughout the process to ensure that their concerns are consistently understood and considered. So examples here would be community boards or community workshops. At Collaborate, the goal is to partner with communities in each aspect of decision making and to actually share the decision making power with them. So examples would be things like participatory budgeting and co-creating design solutions with them. And then Empower is to place the final decision making in the hands of the community. So at this stage, it would be things like community hosted forums and community leadership development trainings. So that wraps up kind of the content of the information. I want to end with just sharing some additional resources that talks more about complete streets and community engagement. So the first link is Building Healthy Streets. That was the first resource that I shared and kind of talks about the steps and partners involved. We have a number of model policies on our website. There's a state level one, and that is, I'll say that's the most recent one. We published it around 2018 or 2019, and that's modeled off of the Complete Streets National Coalition guidelines, but it's framed for a state level ordinance or policy, so you might need to adjust some of the language in there to meet your local context. And then the National Complete Streets Coalition, this is probably where you get the most up-to-date information and examples of where Complete Streets has been successfully implemented around the country and things like that. For community engagement, I mentioned the Planner's Playbook. This is our most recent kind of resource from ChangeLab around community engagement and integrating equity into the planning process. The shared practices for engagement in virtual meetings. This was at the start of COVID. MAPC developed this guidance for how to host inclusive meetings in a virtual format. So I find this really helpful. And then the GARE, or the Government Alliance on Race and Equity, they have a number of tools and resources and trainings for local governments to integrate racial equity into their work. So they're a great resource to check out if you haven't already. And with that, I will open it up to questions.
Well, great. Thank you, Jessica, for the presentation. I mean, there's a lot of information there packed into this PowerPoint presentation. As I did put in the notes, we will be sharing the PowerPoint out with folks later next week. We'll have a whole document with some of these resources plus others that you can use as a part of your research for your municipality. The question that I do have here, and if anybody else has questions, please type them into the chat section and then we can curate them. How is the Vision Zero policy different than a Complete Streets policy? Or can they be the same, or are they different? Jessica, what's your opinion on that?
So I will also say that we are working on Vision Zero as well. Stay tuned. There's a model resolution and toolkit coming out for that, pending probably this summer. I'll say they have different goals. Vision Zero sets the goal to eliminate, right now it's to eliminate fatalities and serious injuries caused by collisions by a certain date. So it simply sets the goal and an approach for doing that. There can be overlapping goals, I think, with Complete Streets. I think Complete Streets is one part of the whole solution to achieving Vision Zero. It's really up to you what you call it, right? Some people or some jurisdictions, they don't necessarily have a Complete Streets policy, but they have a traffic safety plan or some goal, right? It's just whether you want to call it Vision Zero or something else. I would say one cannot be done without the other. They should not, you cannot achieve Vision Vision Zero with that alone, right? It needs to be integrated with other policies, and Complete Streets is a great example. Does that answer the question? I guess so. They are different, but there's overlapping goals in those.
Yeah, I do think that does answer some of those questions that people have, and I agree. You know, Vision Zero is about fatalities and reducing that, while Complete Streets is about inclusivity, and so they do go hand in hand in some parts.
Yeah, and I would say they're both about creating like a inclusive and safe transportation system. So like to me, if the goal of Vision Zero is to reduce fatalities and severe injuries, but to me, any collision is bad. Any near miss is a problem, right? So Complete Streets can help to kind of create that overall safer transportation system.
So another one of the questions that came in. So a municipality goes through the process for an implementation of an ordinance. Typically, what do you see as the next step for a municipality?
So can you say that again?
So after an ordinance is implemented, what do you see is what is typically the next step that people go through?
It would be, so if there's anything specified in your ordinance as what you're going to do, right? Like form a task force or create an implementation plan, or create like a like prioritization criteria, right? You might have a number of projects that you already know need to be done, or what you want to achieve, and how do you prioritize that? You might design some kind of criteria where there's like, where's the highest need of safety concerns, or where people don't walk and bike a lot yet because there's not infrastructure. You might devise some sort of criteria for that. So I would say the first step is to like, build the team, right? So like kind of get your partners together and just get everyone on board first. And I guess like level set, get everyone kind of understanding what Complete Streets is, and coordinated on what you're trying to do.
So one of the next steps is, what communities could you suggest that we look at or follow on social media that may be doing some of these projects?
It's always hard for me to like choose the best one or good examples. I would say go to the National Complete Streets Coalition website. I think every year or pretty frequently they like score Complete Streets policies, and the ones that like kind of rise to the top will be highlighted. I guess that's my answer.
Okay. And you and I can talk about this later on this week, and maybe we can identify a couple that we can put into our email that we'll be sending out to everybody next week. One of the questions, well, hold on, Brian, I'll come back to you in a second here. What are your thoughts on introducing a Complete Streets policy in a rural municipality? And what do you think a Complete Streets might look like in a rural municipality?
I mean, I think Complete Streets can be implemented anywhere. I think the same structure would apply, right? Like have an advisory board, think about where you want to prioritize the investments or the infrastructure changes. The design guidelines and the kind of interventions might look different in a rural context versus a urban context, right? Like you may not need or be able to put in sidewalks and bike lanes everywhere, but there's still strategies to improve the safety and accessibility and connectivity of the network. There are some design standard guidelines that are specific to rural communities. I can't think of the name right now, but I can send that to you afterwards. NACTO, NACTO is a very good resource for design guidelines as well. But I also think the ordinance is kind of what is in your means and feasible to you, right? So in our model guidance, we kind of put out the gold standard of like everything you should consider, but take that as like just simply guidelines and a template, right? You can kind of adapt what will be most politically feasible or financially feasible for your community.
Great, thank you. Brian?
Yeah, I just wanted to add that whenever we developed our complete streets policy over the course of the last summer, I'm sorry, we had worked with a committee of municipal managers and other folks, a pretty good cross-county cross-section of all the different people to put input into it. And we also had that policy reviewed by Jeff Rigner, who is the president of the National Complete Streets Coalition. So ours is more of a policy. It's not necessarily an ordinance. I think there is a difference in that terminology and what it is, and we're really looking to get our municipalities to adopt the policy end of it so that they address the design of any of our public thoroughfares through that complete streets vision. So just wanted to let anybody out there from our municipalities know that that's we did have a lot of input from various municipalities, from urban to suburban to rural across the county, because we have the full spectrum, and we basically created our policy to address all of these.
Yeah, and Randy, you are correct. I mean, that is a great guidelines there. You put in the chat that FHWA has a rural and small towns multimodal network guide. There are things that are listed in there that are oriented to that. So so we'll make sure that we put that link into the discussion piece for next week's mailing. Before I come to you, Randy, I do have one. Jessica, could you provide a brief summary or discussion about experiences forming an advisory boards and to measures taken to create forms or checklists to determine success and measurables? In other words, a couple of tips on how do I do this? Like, how do we find the people?
Okay. I would say, well, so I don't work in like local government, right? Change Lab is kind of a nonprofit or one step removed. So I'm not on the ground doing this, but I would think about who, like those partners are listed on that slide or in the guide: public health, police, schools, fire, those kind of people, and think about like, is there someone with a role of like coordinator or outreach or engagement? They might be good people to reach out to at first, and just from those relationships, right, reach out to them, offer to have coffee or a virtual meeting or whatever, and get to know them, and see if there's any work that overlaps, and then say like, oh, we're forming this advisory group, would you like to join? Reaching out to community members, I think that is very important to have kind of that representation on your advisory group, and that can, maybe you can partner with community-based organizations who already have relationships with community members. They already reach out to them, or like walking and bike advocacy groups. They often have like a big list of volunteers or people on their email list, and they can help you kind of make that connection. In terms of measuring success and evaluation, I'm glad you're asking about this. It often gets kind of like left as an afterthought, right? Like the last thing you think about. I think it's important to measure both like the process and outcome measures. So at the end, like let's say your ultimate goal is create a healthier, more connected street network and reduce collisions. That can take like 10 plus years to really happen. And honestly, it's hard to measure, right? Like, because we put in this bike lane, did that lead to less collisions or more people walking, or reduce prevalence of diabetes in our community, right? That can take a long time to measure and be very hard to measure, but you can measure them, collect data on like the more process measures. Like we have a goal of having a more inclusive and meaningful and authentic community engagement process. So how we might measure that is first, like how many people or who showed up to our events, right? Were they represented from all of the neighborhoods, and especially ones that previously had not really participated what's the age demographic, what's the race demographic, those kinds of things. Do people feel satisfied and that they were heard in their input given to this whole process? Things like that. Yeah, I get.
Randy.
I was just going to add some other maybe suggestions for municipalities. After adopting the complete street policy, certainly if the community hasn't put together a multimodal or active transportation plan, a shout out to the county's Vision Partnership Program. It can be an excellent vehicle for funding those, as well as the state's WalkWorks program. Because I think, to be clear, the complete streets policy, it's not, from a planning perspective, it's not necessarily saying you have to put every amenity that, you don't have to put a bike lane on every single street across your entirety of your community. Rather, you need to then begin to thoughtfully plot out the connectivity of a multimodal network. And so, and if a community has already had some on the books and maybe they've been around for a decade, that's probably would be, in my recommendation, due to kind of have that committee that's formed conduct kind of an audit or an assessment of the plans on file, of, in the lens then now of adopting a complete streets policy. Do these plans remain valid and hold up to the policy that we've now undertaken? And a third recommendation action would simply be for municipalities, then, after gone through those plans, look at your resurfacing program and begin asking yourself, are there very low cost things? And PennDOT and the county do this routinely now on the state's resurfacing program, in the lens of a complete streets, and we're going to go pave, say, 7 roads across the township or municipality. Are there any low cost strategies that, what's the low hanging opportunity to change something and while we're resurfacing? So A, go audit your plans, or A, go do a plan if you haven't done one yet. B, if you have, audit your plans, and C, look at your resurfacing program. I think could be 3 tangible near-term actions.
Great. Thanks, Randy. Do we have any more questions from folks that are out there? Ray, I cannot speak to PennDOT's role. Randy, you want to speak to PennDOT's role?
Well, let me, if Brian, if you wouldn't mind, maybe I'll steer this towards you, Brian Steitch. Can you speak to, I think Ray may have been wanting a follow-up, more elaboration on what you and PennDOT do with respect to looking at the resurfacing program.
PennDOT has a complete streets policy kind of baked into their connects policy, which is essentially, before any improvements are made, they reach out to municipalities to see, what all wants to be, if they want to include any sidewalks, bike lanes, anything like that in that particular roadway segment that they may be developing, or a bridge and things like that. Relative to the resurfacing program, this is done through a DVRPC, Suburban Bike Lanes Work Group. And what we do is we've worked it out with PennDOT to get a lot more advanced notice of what roadways they're going to be resurfacing. I think prior to establishing this group, it was a relatively short window. It was like, okay, here's the roads that are going to be resurfaced in the next 2 months. And there wasn't really much opportunity for the planners to check with those municipalities to see if they might have anything in a current bike ped mobility plan or anything like that, where there might be some facilities that could be added through resurfacing. Now, the way they're able to add facilities through resurfacing is simply by restriping. They don't have the ability to increase shoulder widths or widen the width of the roadways and things like that. And, to be quite honest, on many of the roadways that we've been reviewing lately, I mean, because they're state roads and because they're more, arterials they have higher speed limits, and they're also reticent to add in on many of those facilities due to the speed limits. And that's from a pure safety standpoint. Once you have speed limits above 35 to get into the 40, 45 mile an hour range, it become, the chances of, pedestrian or cyclists, those surviving an accident when you're struck by a vehicle at that speed is relatively low. So they have a tendency just from a liability standpoint to shy away from that. But there are opportunities that we see going in through the boroughs, particularly for adding bike lanes in some of the lower volume roads that may be close to other things, of adding sharrows. I think we've seen some sharrows added in through the borough of Elverson in many places. I think there's sharrows in Westchester Borough that came from our county central Chester County Bike Ped Plan. So, yeah, I mean, I think, from the PennDOT perspective, they do their best to, try to accommodate these things. But again, many of the roadways that they have are more of the higher speed arterial type roadways. So there aren't as many opportunities as we would probably like to see. But, working with the municipal, I think the real opportunity is, as Randy mentioned, is, working with the roads that each municipality has under their control, the local road network, because those are typically your lower traffic volumes, maybe wider streets and lower speeds. So you have many more opportunities to, provide for those facilities in those roadways as opposed to the state roads.
Thanks, Brian. We are close to the hour here. We have a couple more things that we'd like to cover. One of the things that you will receive again next week is in the email that we'll send out. The Department of Transportation, US DOT, released their guidelines for the Safe Streets and Routes for All grant funding. So that was the notice of the funding, that there is going to be up to $500 million for implementation projects. But there are some guidelines that go with that. So we'll include that in the packet of information there, so that everybody will have that to think about for their municipality. Jessica, thank you very much for being with us today. Do you want to throw up your last slide there? Because I know your contact information is there. So people want to quickly write that down. And as I said... Oh.
Let me share this again.
So if you haven't registered, please register for our Monday morning memo. You can find us at tmac.org. Our next in-person event will be on June 9th. We will be over across the street from our offices at the Lot 6, it's called. So it will be our annual meeting. It will be fun. We'll have some interactive stuff early on, but it'll be focused around networking. So everyone, thank you very much for joining us. And when we close out, I know there was going to be a brief survey for everybody. Please take that survey, and then we can gather some information about how we need to proceed for future programming. Again, thank you, everyone. Thank you for being with us.